You're listening to the first and only Filipino radio station in Qatar. 94.3 Kabayan Radio. Kabayan Radio 94.3. Loud and proud.
Mga kababayan.
Kabayan Radio 94.3.
The first and the only Filipino radio station in Qatar. Kabayan Radio 94.3.
The best music that you want to hear. Morning, noon, and night.
Have a brighter and wider smile with Gulf Dental Center. Gulf Dental Center is one of the biggest dental centers in Qatar that offers modern dental services with their cutting-edge technology and facilities. You are in safe hands from start to finish. Gulf Dental Center, where beautiful smiles are created for you and your family. For more inquiries, please call 77956366 or visit their branches at Hilal, Duhail, Wakra, Old Airport, and Alabeb. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
A wonderful Tuesday evening, everyone. You are tuned in to the first and the only Filipino radio station here in Qatar, Kabayan Radio 94.3. My name is Kenzo.
And of course, Ati Girl, RJ Andi for another episode of The Doctor is In.
And yes, right now we are live on Facebook. If you would like to see us live here in the studio of Kabayan Radio, all you have to do is visit our Facebook page. It is www.facebook.com/kabayan943.
And partner, alternatively, pwede din silang bumisita sa ating official website, which is kabayanfm.com/radio. And we are also going to have this video on our YouTube channel.
Yes, and tonight, ano nga ba ang pag-uusapan natin?
Ay nako, ang dami nating pag-uusapan. But
Yes.
before that, we definitely have our the doctor here as our guest for tonight. He completed in graduation 2005, completed post-graduation in 2009, born and raised in Doha, presently working as a specialist orthodontist at the Gulf Dental Center, and has been 10 years in the same company.
Wow.
So we've got Dr. Deep Mathen.
Hi,
Good evening.
everyone.
Good evening, and welcome to The Doctor is In episode.
Thank you. Thank you.
Yes, and tonight we are going to be talking about cosmetic dentistry and as well as some other treatments that would make our smiles even more
Yes.
brighter. So I guess we can start now and dive into the discussion. Doctor, I would like to ask, what is the general definition or overview of what dental or cosmetic dentistry is about?
So, as the name suggests, cosmetic dentistry involves enhancing dental cosmetics. Yeah, predominantly it's about enhancing dental cosmetics. So when we say dental cosmetics, it's all about veneers, teeth whitening. It can be repairing a chipped tooth, anything like that. But the other less spoken about aspect of cosmetic dentistry is enhancing smile cosmetics, right? So when we say enhancing smile cosmetics, it can be doing a simple laser gum procedure.
Okay.
Right? So that sometimes it goes hand in hand along with doing veneers as well.
But when we say cosmetic dentistry, does it mean that it's going to be an invasive type of treatment, or there are also non-invasive type of treatments?
Well, most of the cosmetic treatments are not invasive.
Okay.
So as I was saying, earlier, if it's going to be a laser gum surgery or anything like that, that is, as the name suggests, you can say slightly invasive procedure. But otherwise, more or less, everything is, non-invasive.
Right. And I think teeth whitening is part of
Yeah,
it,
that's,
and it's non-invasive.
Yeah,
so.
yeah, absolutely. It's not invasive as
And
well.
also, Kenzo, I would like to talk about the teeth whitening since you've already mentioned about it. Doc, do we have like side effects, any side effects when it comes to teeth whitening?
Yeah, the main side effect is teeth sensitivity, right? So that's what most people say. Like after teeth whitening, sensitivity may last from a few hours
Right.
up to sometimes 2 to 3 days.
It's only temporary. That's what you're saying.
Yeah. It's temporary. It lowers down as time progresses.
Right. That's actually what I experienced. The one that I was telling you, because we were having a conversation about teeth whitening. Apparently, she did not have like any side effects,
not have.
but I did have, and it was quite terrible for the first night. But the following day, everything was okay.
Perhaps her teeth is stronger than yours.
And my personality too, Doc. Anyway, so
yeah.
we've already mentioned about the cosmetic dentistry and of course the teeth whitening. Now, I am quite curious about the treatment that we're about to talk.
Yes.
Can you ask doctor about what it's all about?
Well, the last time that we had some dentists and orthodontists from Gulf Dental Center,
Yeah.
we talked about braces, and
Right.
there is an alternative type of straightening.
Right.
If I can use that term, the
Right,
teeth,
yeah.
and it's called Invisalign. Can you tell us something about what Invisalign is?
Yeah, so as you mentioned, Invisalign is basically a clear alternative to braces. Yeah, so when you have malaligned teeth or you have teeth which are protruding, or sometimes even in certain cases when you have jaw issues, like for example,
Okay.
A lower jaw which is set back, like placed backward, right? And if it's a growing boy or girl, we can always do appliances even with Invisalign, which will help in getting the jaw corrected forward.
Okay.
Yeah, but to answer you, we can do all kind of treatments, all kind of malocclusion or all kind of orthodontic problems with Invisalign.
Okay.
Okay, certain situations prove to be hard, like for example, if you've got an impacted canine, which involves use of something called as a traction force, meaning to say you need to pull the tooth from up down
Going
into
down.
the
Okay.
into the arch. That can still be done with Invisalign, but it's a bit of a challenge.
It's going to
Right.
take a long time. And would it be better to have braces instead of
In what?
Invisalign?
When you have
The one that with the impacted tooth?
yeah, look, when you have impacted teeth, it's slightly faster if you do a bit of braces first and then do Invisalign.
Okay.
Right? Only in that case.
But-
But otherwise, sorry to interrupt.
Yeah, it's okay.
But otherwise, by and large, you can do all kind of dental corrections with Invisalign. It doesn't matter regarding the time. It's actually, in many cases, Invisalign is faster than braces.
Oh, okay.
Right.
So what is Invisalign basically made of, and how does it look like when you are wearing one?
Look, Invisalign is a high quality plastic. Okay, so if in very simple terms, it's a very high quality plastic, and it's very thin, which adapts to the tooth. Now, how do we do that? It is by doing, like, normally there are two methods to do Invisalign, right? You can either do an impression, meaning to say you can, I'm sure like everybody has done a dental impression, which is taking the size or the measurement of the tooth or of the entire arch. So what we have there at our centers, we've got the latest 5D dental scanner, right? So what we try to do is to be a completely digital treatment setup as well. We've got digital X-rays, which minimize radiations than a conventional X-ray unit. And also, we have got the latest digital 5D scanner. So the advantage of that, we can do accurate measurements of the teeth, and we can send it across to the central database in US, where they actually manufacture the complete set of Invisalign aligners.
Okay, so those aligners are manufactured outside of the country, and then it's being delivered here. So after the measurements are done, the measurements will be sent to the US, and then the braces or the Invisalign will be sent here.
Yeah,
for
so
the
perhaps
clients.
what
Okay.
I can do is I can just run you through the whole procedure.
Sure, sure.
So, for example, if Mr. X or Miss Y walks in, right?
Or maybe Andy?
Yeah. Okay. Yeah. Sure. Why
Use
not?
me as your model, Doc.
So, and you can get him along as well, just to
Yeah.
give you a company. So, let's say if he was to do braces and you were to do Invisalign, right? What would be the difference? So perhaps our listeners could understand better with
exactly.
that scenario. So if you were to do braces, right? Both of you walk into the surgery together at the same time. First procedure, X-rays, 2 X-rays for both of you. Yeah, it's the same.
It's just the
Okay.
same.
It's same. And then you walk in and we have a checkup.
Mm-hmm.
So if everything was fine, you don't have any, you've done a teeth cleaning earlier. Let's assume both of you have done teeth cleaning and fillings and everything.
Right.
You've got ready to go teeth, right? There's no other dental
Concern.
problems to address, and both of you are ready to start the orthodontic correction. So if it were you, we would straight away go ahead, fix, and I would ask you, do you want metal or ceramic braces or self-legating, whatever type of braces, metal or ceramic, and then we choose and we fix it off.
Right.
And since she's the Invisalign patient, I would pull up my 5D scanner, and then we'd scan and do her photos. By the way, we would do photos for you as well. And the difference being, we would upload it entire onto the database. And in a couple of days, right, I would have the digital treatment set up on my system for her.
Only for me.
Yeah, only for you.
Okay.
So that's the point to be noted here. So Invisalign is actually a custom-made
Right.
device. It's a custom-made treatment option. So braces is something like, you just go to the medical supplier and, you buy braces and then you fix it across, right? It's the same, well, not exactly the same because it's different. We cannot use the same brace used by someone and then fix it onto the other. So that goes without saying. What I'm trying to say is that
It's like more customized, I guess.
yeah. So what I'm trying to say is like, you've got 2 boxes of braces and it would be the same if, you'd fix them to you and it would be
Right.
another box for her. But with Invisalign, it'll be an entirely custom-made appliance. The other important couple of points to be, kept in mind there is that you do have something called a Smile View tool, which actually helps you to see your end result. Like RJ Andy can see her end result
Okay.
before you even actually start the Invisalign progress.
Okay.
So that actually kind of helps you to
decide.
To visualize,
Okay.
right? How your smile is going to change, right? And what is it going to be? Because sometimes what happens is the orthodontist has got a plan, and the client kind of just everything, the progress or the end result is totally on the faith between the orthodontist and the client. But sometimes, look, like I've had certain especially ladies who come and say like, I don't want my teeth entirely to be straightened because I want it to be like bunny teeth because that's in
That's what's in.
yeah, so that's what's
In
in,
the fashion world, it's the bunny teeth.
Yeah.
right? So when you just go ahead and do what you think is ideal for that for a certain person, that's what happens. Like you'd just be off from actually what the client wants. But with Invisalign, you would actually get to show. This
Right.
is what you.
Before doing it.
This is what your end result is, and are you happy with that? And then you'd say, actually I'd like the bite to be a little different. I'd like this tooth to be. I like a little space between there. I don't want to be perfect.
Right.
So that's the point I'm trying to touch. So Invisalign allows the doctor to individually move each tooth.
Wow.
So that's the beauty of Invisalign.
So you can actually design how it
Yeah.
would look like.
Exactly.
at the end.
Absolutely.
It's more of like
Customization of your
Wow.
own teeth and how should it look afterwards.
But is it just one aligner, or do you have to change aligners
No, it's a
from time to
series.
time?
It's a series of aligners. So every now, how many aligners?
So it's similar to like when you are having braces, it will be adjusted, right? So this one, once it's time to like sort of adjust, if I can use that word, you're going to change a different aligner.
Yeah. So again, it depends on what the what the problem is.
Okay.
Right. So just in case if it's a space correction, right? Like there are spaces everywhere. So then you could, by and large, you do a 20-hour cycle, like a 20-hour wear cycle every day, right? But if it's a space, like just about spacing in both the upper and the lower arches, then you can, let's assume that he or she is wearing for about 18 to 20 hours every day. Then he or she can change the aligners every 7 to 10 days,
Okay.
right?
Okay.
Except while having food or tea, coffee. Something
Exactly.
Like
That's what I was going to next.
Right.
How long do you wear it? You've mentioned like around 18 hours.
18 to 20
so
hours.
Would it be challenging to speak or to talk when you are wearing aligners?
Are there gonna be different?
When you
Because
try to
you have your plastic
yeah.
aligner.
So when you wear anything, or when you have anything inside the mouth, even if it's a denture or a small prosthesis, right? The mouth produces more saliva,
Yeah.
right? I don't know if you have noticed that. I'm sure some of our listeners would have felt that at some point of time as well. So when you have excess saliva in the mouth, that's when you kind of, the tongue goes haywire, and it kind of doesn't allow you to talk freely. So certain syllables, certain letters do not get clear,
Okay.
right? So some clients do experience a little bit of lisping the first few days, during
Okay.
the first few days.
Okay.
But then as the mouth gets used to it, this tapers down, and then they're fine.
And you can use it the entire day
Yeah, you
without
can-
having any issues.
Yeah.
But that's
But
18 hours.
in
Yeah.
maximum time, right?
Look, what I generally tell everybody is you need to be very flexible, because sometimes, like for example, she's doing
Radio work.
radio live.
I talk a lot, Doc.
Yeah, sure, I can see that. So, radio live programs, or apart from radio,
Right.
if you're doing a podcast,
Right.
or you're doing any kind of presentations or something.
If you're on camera as well.
So,
You just can't remove it.
yeah, and so that's when when you go on live, you could just remove it, keep it aside, and then finish off your program, your
Okay.
presentation, your
Right,
lecture,
right.
and then wear
Put
it
it
back,
back
on.
on.
So, or for example, if you have a party, you're socializing, you don't want to remove it in front of others, then you could just remove it earlier. But what I'm trying to address here is that, as we mentioned earlier, it's like roughly 18 to 20 hours per day. You can change it 7 to 8 days. Why I said 7 to 10 days is because let's say for a certain reason you haven't worn it for that much period of time. Like for example, you have worn it for maybe 10 hours, right? Because you've been busy. Basically, you've worn it only whilst you sleep, right? So then what you do is you're up your wear time by increasing the number of days.
Okay.
So if you've worn it all the time, right, 7 to 8 days is fine. But
If you're wearing it on a shorter period, then the
then you
time
just
frame
increase,
would.
yeah.
Awesome.
Okay.
Increase.
Yeah,
All
just
right.
increase it.
So
like
it's still
that.
okay even if you're just gonna wear it at night. I mean,
Yeah, but if you just keep wearing it at night, the problem is, you'd need to use it for even up to
An
2 weeks,
okay.
and then we might increase the total treatment time,
Right, definitely.
right? Because in modern day people sleep less, so what
That's the
six
truth,
six to
though.
7
Speak
hours.
about it.
Yeah, so we all get to sleep less. Yeah?
Like 5 hours is okay, right?
Hours is well, sometimes I get to sleep 4 or 5 hours.
Alright.
Yeah, maybe even less. But
Especially for
technically-
those who have families here in Qatar and you
Yes,
have
of
kids, and
course.
it's going to be challenging.
But ideally 5 hours
Yeah.
is less. Ideally 5 hours is
Yeah,
less.
yeah, yeah.
I think about 7 hours is what you actually need.
Mhm.
5 hours is perhaps you're asking for trouble.
Well, I'd like to also ask, since we've already talked about the process of the Invisalign treatment, what are the primary benefits of this treatment, Doc?
Look, as we ran through this earlier, but primary benefits of Invisalign, first and foremost, it's a clear alternative. So your brushing is easy. Your whole you lead a normal life.
Less painful.
Painful. Well, I wouldn't say it's going to be less painful. Yeah, you wouldn't have pokey wires, at
Yeah.
the corner, or some ulcers here and there. But yeah, it's a more comfortable process,
Mhm.
right?
Mhm.
It's not going to bother you. Many a time, some of my clients they come and ask me, like, we went out, we socialized, and that's the time when my friend actually noticed that I am removing my aligners.
Mhm.
So, nobody would ever get to know that you're doing a treatment, unless, like, for example, let me quote you again. So if you're doing Invisalign, and after a few months, when you've got more straightened teeth, that's when probably he would notice and say, hang on, you don't have braces, but how do you get your teeth straightened?
Magic.
So that's the beauty of that, So so again, that's very highly cosmetic treatment. And it's a very high cosmetic.
But usually, how long is the period for these treatments? Like, on average, because I'm sure that it will depend from one person to another, depending
It
on the
depends
concern
on the
that they
case.
have.
More not about more one person to other, more about the case in which the severity of the
Right.
problem. So if it's just about spaces, obviously you would finish faster.
Right.
But if it's like a growth modification procedure, it would take about 2 years, 2.5
Okay.
years.
Okay.
Yeah. So I would say it would anyway between, say, 6 months up to 2 years,
Okay.
2.5 years. It depends
Depending on the case.
Yeah, depending on the case.
the
Also
next-
depending on the, sorry to interrupt you.
Sure.
Also depending on the client's wear routine, right? So since we spoke all about the advantages, right? Let me just touch on a disadvantage, right? Because I'm sure our listeners would
Yeah.
would
Yeah,
want to get to know about, because everything has got pros and cons.
Right. Right.
So I'm sure they would want to know, are there any disadvantages? So disadvantage per se would be the fact that the doctor or the dentist does not have a control on the wear cycle of the client, right? For example, we give the aligner to her, RJ Andi, and she doesn't wear it as much as I would like it to. Like, for example, as she said, I'm just going to wear it while I sleep, right? So then the entire duration gets more than what we have planned,
Right.
right? And then at a certain point of time, it just gets a little bit challenging to finish it as what we initially planned. But with braces, it's more, you've fixed it, and then that's about it. So it's compliance is an issue if it's
Discipline.
Right.
So if it's, but apart from that, everything else,
Okay.
Invisalign is much better than braces.
Okay.
Let me see. I'm not anti-braces,
Right.
but it's just that I don't want our listeners to feel that.
But why did you use me as an example for braces? No, just kidding. Kidding aside. I would just like to ask.
we need to be soft with ladies?
Yeah, I know.
Right. Well,
But I would like to know, is there like a guarantee that your concerns would be fixed if you wear Invisalign, or are there cases wherein it
Does it make
doesn't
any
work?
change?
Yeah, right. So, as we mentioned earlier, Invisalign is all about planned treatment, right? So we plan the treatment, what we want. The entire series of aligners are intended to move a particular way.
Right.
Now, what happens midway or somewhere there, about midway stage, the tooth didn't actually move to where we intended it to. So that's the time when we intervene, and then we do a new scan and give a new set of aligners,
I see. Okay.
right? So it's always the fact that the Invisalign series of aligners do the job. But sometimes it could either be that the tooth was a little bit more challenging and it didn't move exactly how we want,
Right.
or the client didn't wear it as much as I had instructed it, him or her, and then they progress to the next aligner, and then the few more aligners, and then it's too tight, and then they come running back. So this is one of the main reason why I don't give. A lot of people ask me, Doc, you have my entire set of aligners, and why didn't you give it to me? So I generally don't have the habit of giving the entire set of aligners up front,
Okay.
so that I can have a little control on the tooth movement as well. So I generally see everybody in about 8 to 12 weeks.
Right.
Cycle.
Okay. I just wanted to know, are there like any limitations about what other procedures you can do once you already start your Invisalign treatment? Like, for example, if you're going to have dental filling or any other treatments, would it affect the Invisalign treatment?
Yeah, I did get your query there. So, by and large, dental fillings do not have an issue because they are actually restoring the previous dental anatomy, right?
Okay.
Unless and until it's an extensive restoration, meaning like a crown or an onlay or something like that, which would actually change the shape, of the previous tooth structure.
Yeah.
So in that case, let's say tooth, for some reason it broke, or you needed to do a crown there. So in that case, right, what we do is to intervene, and then we stop the set of aligners there. We do a new scan and give a whole new set.
But in most cases, you already try to do a full scan in the beginning and do all the necessary work before the Invisalign.
Yeah, that's why if you remember, I was saying that when I quoted the example of both of you, so I was saying assuming the fact that both you've done the filling and the cleaning and all the restorations done, because the first thing that we do is X-ray just to see that if everything is all right, and then we repair the teeth. Right, we do all the fillings. We sometimes, if you have a cracked tooth, root canals, do the crown there, and then we start with that.
The procedure.
But for some reason, if during the course of the time, if you develop a new cavity, or if you have another issue, right, and then the aligner is not as fitting as the previous one that you were wearing, we do a new scan to give you a new set and give you a new set of aligners.
To the beginning then.
Yeah, you don't have to get back to the beginning. We just continue.
Just continue.
Yeah, we just continue, but we change the plan there a little bit,
Okay.
right?
Okay.
Because it's all about the fit of the aligner. We want the aligner to be a snug fit, right, so that the tooth moves as we intend it to move.
Right. You know what, Andy? I'm getting more and more convinced about getting Invisalign. But this is really a very interesting discussion. We're going to talk more about, Invisalign and how it differentiates with braces a little deeper after we go on a break. And of course, we will still be having Dr. Deep here in the studio. And again, this is the Doctor is in. We'll just go on a very short break. We'll be back shortly.
Current time is 7:30.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Combined Radio 94.3. Have a brighter and wider smile with Gulf Dental Center. Gulf Dental Center is one of the biggest dental centers in Qatar that offers modern dental services with their cutting-edge technology and facilities. You are in safe hands from start to finish. Gulf Dental Center, where beautiful smiles are created for you and your family. For more inquiries, please call 7795-6366 or visit their branches at Hilal, Duhail, Wakra, Old Airport, and Alabeb.
You're listening to Kabayan Radio 94.3, the first and only Filipino radio station in Qatar. We are taking radio to a whole new level. Kabayan Radio 94.3.
With more than 257,000 unique audience and more than 60,000 followers, Kabayan Radio 94.3 FM is the best. It is the best marketplace for your advertisements. For inquiries, please contact our sales and marketing department at 44994944 or email info@kabayanfm.com.
The best music that you want to hear. Morning, noon, and night.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Combined Radio 94.3.
Once again, mga kabayan, welcome to The Doctor is in, our special episode tonight with Mr. Deep here of the Gulf Dental Center. And I am here with my partner, RJ Kenzo and RJ Andi. Now, going back...
Yes. We have talked a lot of things earlier, particularly with Invisalign. We discussed what the treatment is about, how it looks like, and the duration of the treatment, as well as the benefits and the advantages of having Invisalign treatments. And right now, we are going to talk more about the difference of Invisalign with braces. I think we already touched on this earlier, but can we ask for more information about like the major differences that Invisalign has with dental braces?
Well, again, as we, just to recap, so primarily it's a more custom-made device, right? As we mentioned earlier, Invisalign involves scanning or taking the size of teeth. It's a custom-made treatment plan, whereas braces is something that we, purchase from the supplier, and then we fixed it, and it's an individual. Every doctor prepares an individual treatment plan, and then we like the braces to do the job as well, along with the the doctor's expertise. But with Invisalign, you can actually determine and control the tooth movement to the precise position what we intended to be. So that's
That's the major difference between the two then.
Right. For braces, post-treatment, usually we wear retainers. So how about with Invisalign? After the treatment, is it, do we wear something or everything's good?
Just to recap, I just wanted to go to our previous question because I just remembered another point. So another main aspect of Invisalign is that, look, sometimes braces, we do the adjustments and we do the regular follow-ups, but the tooth doesn't move, right? It just doesn't move how we intended to. So perhaps the brace has some kind of a manufacturing issue, which you cannot really find that out, right? And sometimes the angulations which are incorporated within the brace is not enough. So that's where Invisalign you can actually increase the angulation of the tooth digitally. So that's the beauty of this appliance, because your finish is going to be that much more beautiful.
Okay.
That's why I touched earlier about the fact that when you see your smile view,
Right.
when you see yourself, because they use the AI, artificial intelligence technology, to show you that the end result. So that, first of all, to see yourself in what you intended to be, sorry, that's very convincing, right? Because you'd know this is what I want.
Yeah.
So again, it's a beautiful appliance which has evolved over the last 22 years.
Right.
Invisalign. Again, now just to get back to the other query that we were asking. Look, braces, Invisalign, whatever we do, right? At the end of it all, we do need retainers.
Okay.
Right? Because you've moved teeth within the bone. It's something like, if you have had a fracture, you need a sling, right, to support.
It's more like a support.
Right.
Yeah,
Okay.
so it's a support for the tooth in the newly moved tooth position, right? So we want the tooth to be there. So Invisalign, braces, that aspect doesn't change. We do need retainers.
And how long do people need to wear retainers?
Retainers, well, the first 6 to 8 months would be full-time wear. If they can wear one year, that's even better. But at least 6 to 8 months full-time, and then you can wear the retainer for a nighttime wear.
Okay.
Look, the more the retainer wear period, it's that much more better.
Okay.
So to
So
just
again,
keep
Discipline
it
is the key.
yeah, discipline is always the key.
And getting into that particular routine, getting
Yes.
into that particular routine. Now, I'm sure that many of our viewers and listeners right now are curious. How much do these procedures cost?
Well, look at Gulf Dental Center. We've gone, and I'm sure most of our listeners are, Kabayans, and I'm sure at least 70 to 75% of Kabayans are, clients at Gulf Dental Center. So I'm sure they know that Gulf Dental Center prices are, competitive. They aren't high.
Right.
But we offer we aren't the cheapest, right? We don't want to be the cheapest. We want to be people who provide the best quality, best service, and affordable prices.
Right.
That's what our
with the best doctors
USP.
as well.
Yes.
Yeah.
Every doctor that I met from Gulf Dental Center has been really amazing.
Yeah,
and I've met a couple of doctors already. From
Yeah, I'm proud of of our entire team, my colleagues, our support staff, our management as well. They are not like normal managers. They aren't very bossy. It's a very friendly atmosphere there. So
And they definitely love Filipinos.
Right?
Yeah.
We had this one celebration with them
Yes,
within this year. Anyway, let's get back to what we're talking
because,
about.
we were talking about Invisalign and braces and about cosmetic dentistry in general. So apart from these two treatments that we have discussed, what are the other treatments that are available in your clinics?
in terms of cosmetic dentistry,
Yes.
yeah. So I'm sure our listeners know cosmetic dentistry is about Hollywood smile and then the whitening of teeth. We did touch upon that earlier, and then small cosmetic fillings which are in the front teeth, like which are part of the smile zone, if you may call it that way. Yeah, and then the other thing which I had mentioned earlier about laser, gum process. So on which situations we use that? That's during or people with gummy smile. So people with a gummy smile, not someone who's got a very extensive gummy smile, because that would, if somebody has got a very extensive gummy smile, that would be something to do with a skeletal issue. Right. So if it's a minor to moderate sometimes gummy smile, you could do laser gingiviectomy. That's the term which is given to that. Basically, it's a laser procedure which would reduce the height of the gums, and
but wouldn't that look like you have a huge set of teeth?
So that's why I said we wouldn't do it in all the cases,
Okay.
right? So sometimes what happens is the clinical height of the tooth is
Right,
something which
right.
is very important to look at. So again, that's a very case-to-case basis,
Right.
but it is done. Sometimes we do both, like veneers and
I see.
sometimes we need to increase the height because there's a ratio to keep in mind.
Well, that's good to know. They have a range of treatments that are available.
All available in all of the Gulf Dental Center branches?
Yeah, most of our branches. But Hilal is one place where it's a stop, one stop.
That's where I go to.
Shop.
That's where I go to.
It's centrally located,
Yes.
and most of our listeners are, I'm sure, around Old Airport, Al Saad, Mansoura, Muntaza.
So, how many branches do you have right now?
Where we are, we have 5 branches under Gulf Dental Center and 2 branches under Family Medical Polyclinic.
Okay. And can you please let our viewers and listeners know which locations are these?
So Gulf Dental Center, the first branch which we opened was in 2004. That's in Hilal. So in another year and a half, we'll complete 20 years. The GDC or Gulf Dental Center family. The second branch was opened in 2009 in Duhail. The third branch was 2011 in Wakra. And then it was the airport branch, and the last branch or the latest branch was a few months before the COVID pandemic, and that's in Labaib, which is behind IKEA.
Okay.
Right? Meanwhile, during all of that, we did open 2 family medical polyclinic branches as well. The first one was in 2014 in Wukair, Al Mashaf, that side, and the second branch is in Azizia.
Okay. So wherever they are located in and around
Go to the
Doha,
nearest Gulf Dental
Dental Center, yes.
So as I said, Hilal is one place where everyone's there. You'd find a root canal specialist, you'd find surgeon, you'd find me there.
Oh, you're there. Okay,
Yeah.
I haven't seen you there.
That's because
Maybe sometime soon. When I go there, I'm gonna look for you.
Definitely have
Problems on your teeth, huh? No.
Well, you have to go to the dentist every 6 months.
Even if you don't have problems, well, you have to begin with.
So I visited 3 of our branches. So
Okay.
perhaps you were there when I was at probably Azizia or at Lebaib, one of the other branches.
But I would like to commend the staff and the doctors
Very
there.
accommodating.
I met Dr. Afaf, Dr. Majdi, and they did really good jobs with my teeth, I guess. And also the reception was like very accommodating.
Even the Filipino doctors right there.
Right, yeah.
Definitely very
As I said, we've got a good we are a good unit there, a good cosmopolitan unit, different
Right.
nationalities under one umbrella. So apart from Kabayans, we've got we've got
Most of the nationalities.
yeah,
right?
we've got Europeans, we've got Asians,
Right.
we've got Africans. So I even have some with due respect to everybody,
Sure.
but I even do have a Nepali customer as well, with Invisalign. But sometimes people think that we we just offer braces only, but everybody wants to get. It's not about cost. People want the best service possible.
Right.
So people are willing to shell out a few extra thousands for more quality.
Right, and to have a better smile, because at the end of the day, that's what's
Exactly.
important.
Exactly.
To have that wonderful, beautiful smile, because it's just really nice
Say
to
that it's the smile that talks about your personality more. So
Yeah.
you just have to smile more
yes, and
and worry less.
and I'm sure that all our viewers and listeners would be smiling more if they would know if there are promotions currently happening.
Yeah.
Yeah, we always do have promotions there, and I think it's always uploaded on Q Promo,
Right.
or our website,
Mhm.
and also on all the social
do have
media
Facebook
Facebook
handles.
page.
Right.
Yeah,
right.
Facebook page and social media handles.
And we do announce some of their
Yes.
promotions. So all you have to do is to listen to us, and you'll be updated whenever there are
All year
promotions.
round.
Yeah.
Tune into Kabayan FM, and then you get to know about the promotions as well.
That's
Right,
Doc.
right.
That's right.
Anyway, thank you very much for the
Sure.
wonderful conversation, for all the information that you have provided
Absolutely.
us tonight about cosmetic dentistry, focusing on Invisalign and touching as well on the braces. And just before we end the program, is there anyone that you would
It's your
like to say hi
time.
to?
Maybe say hi to all of your.
Yeah, sure. I'd like to say hi to all of my colleagues, doctors, nurses, receptionists, and our account staff. Maybe I'll just take out a few names.
Yeah,
Sorry,
go ahead.
don't be upset at me if I haven't taken out your name. A big shout out to Lynn, Ruby, Noreen, Mark, Karen K from the reception, and Awatif, and then a couple of my patients as well. Jazz, there you go. Shout out to you as well. And then I do have a lot of Kabayan cabin crew
Okay.
from Qatar Airways. So if I have to take out their names, it's going to be a huge list.
Okay.
So big shout out to all the Kabayan cabin crew as well.
Hi guys.
Hello, and thank you for always tuning into Kabayan Radio.
Yes, of course.
Well, thank you so much for joining us here in the studio, and we hope to see you back again.
Sure. Thank you for having me in. I'm
Thank you
looking
so much,
forward
Doc.
to be next time on your show as well. And looking forward to see you next time when you pass by there.
Yeah.
I hope I'm there in that branch.
Yeah, Hilal branch.
Okay.
I'm sure. I'm sure. You are anyway there to be. He's the one who says that he can't find me there.
You're always going to the airport branch, right?
Well, yeah.
A couple of times you've been there.
A couple of times already.
And RJ Cody as well goes to that branch.
We did a live
Procedure on Facebook, by the way, guys. Okay.
So I'm looking forward both of you to be seen in the Hilal branch. Yeah.
Okay.
All right.
I'm gonna bring them sometime
We'll have
soon.
to schedule that.
Absolutely.
Anyway, Dr. Deep, Mathen, thank you very much for joining us. Of course, from Gulf Dental Center. And again, thank you very much for your generosity and support to Kabayan Radio. And sabi nga natin, di ba, partner, di ba?
Yes.
Gulf Dental Center is where all smiles are created for you and your family. And tonight, we would like to thank each and everyone for joining us here at The Doctor Is In. My name is Kenzo.
And my name is RJ Andi.
And stay safe, keep smiling, be blessed.
Bye-bye.
Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.